Good afternoon, welcome back. This is Simon Adim. If you haven't met me before, I'm a nurse from Southeast England. In today's video, I'm going to talk about medication safety and how can you become a safe nurse while you're doing the drug round. How can you avoid making errors? How can you avoid causing a emergency? Yeah, how can you make your license safe? All right, so because we as nurses, it's our job, it's part of our job to do the medication round, and we have 3 or 4 drug rounds in a day. If you're working long day, in a night as well, we have different timings for the drug rounds. Yeah, so if a patient is on TDS medications or QDS medications, so we as nurses, we do the drug round each time. Yeah, so I'm going to give you basics, tips and tricks and the checks that you need to follow before you do the drug round, and how it can save you time, how it can save your license, and what are the mistakes that you need to avoid, and what you need to learn, what you need to know before you start the medication round. Okay, so let's dive into the video without any further delay. Thank you for coming back and joining me again. So first of all, medicine checks. When we are here in the UK, even back home, you'll get a drug trolley. Okay, in your drug trolley, according to your specialty, according to your area, according to the area that you're working in, the common medications you will be have in the trolley. You will have all the supply of regular ward stock medications, and you will be given a key for that drug trolley. So you are in charge of your drug trolley. You will be having the keys, and you need to keep the keys safe. You need to keep them in your pocket and only give it to somebody if you are going on a break or you are going away from your ward. So because at the end of the day, you need to give handover with your keys. So you give the keys to the next person who's coming on the shift. So having the keys, keeping them safe, is very important. That is the first thing. That's the second thing I'm going to talk about is the medicine safety checks, rights of the medication doing, right, of the medication administration. So for newly qualified nurses or experienced nurses, it doesn't matter how long you've been working as a nurse, you need to do the checks correctly. Every time you do the drug round, you need to do the checks correctly. I know if you're working in a care home, it's a different scenario, but still as a nurse, you need to do the checks. I heard in care homes, if your residents are like old patients that you know them and you've been nursing them for quite a while now, you are aware about their names, you are aware about their allergies, medication allergies. But here in the NHS is totally different. Patient comes and goes. So every time you do a drug round, I would say wherever you work, whether it's a care home, whether it's a nursing home or a hospital or an ED, you need to check the ID bands. You need to confirm the patient name, date of birth, and allergy status. Okay, and always, whether it's just paracetamol, whether you are just giving paracetamol to the patient, always confirm the ID of the patient, always confirm the identity of the patient. Okay, because it will save your license. Okay, so this is the most important tip that you need to remember. Check the ID first. All right, so for the patients who are not confused, who are alert and orientated, they can tell you their name, their date of birth, and their allergy status. But for the patients who are confused, or they are under any medical condition that they cannot say you the name or date of birth, you can always check a wristband. Okay, so for the patients who have the wristbands, usually here we have 2 kinds of wristband, red and white. White means they don't have any allergies to any medications unless patient tells you that they have this allergy. So when they first admit to the hospital, they usually come with the relative or with any other family member. So we take the history, we ask for the allergy status, and if they know, they'll tell you. So if they are having no allergies, then you are going to give them white wristband. But if they are having any kind of allergy to a medication, to any food or any other thing, they will get a red wristband. So if you are doing drug round and you see a red wristband, you should just get conscious and then alert that there is some sort of allergies. Okay, so make sure you check the allergy status before giving any medications, especially the antibiotics. Some people here, they also have allergies with Brufen or with paracetamol or codeine, so always make sure that you check the allergy status of the patient. Right, so we were doing the ID check. We found out that the ward patient is in is not mentioned on the ID band. So usually the wristband, I'll give you a scenario. So we have the patient name, we have the date of birth, NHS number, and the ward they are currently in. Okay, so when you receive a new patient from a different ward, it is your responsibility, or you can ask your receptionist to get a new wristband according to the ward they are in. Okay, this is very important. And if you don't update the wristband, if patient is confused or a wanderer or they go out, nobody will be able to get them back to you. All right, because on the wristband the location says something different and they are in the different ward. All right, so yeah, that was the wristband and ID check. The second thing I'm going to talk about is the rights of the medication. So we are going to give it to the right patient, right time, right drug, right dose, right route, and I always include right documentation. So if you give it to somebody, always make sure that you document what time you gave the medication, because if they are having any stat medications and you have already given the regular medicines, the timing is very important to know. Also, one thing I want to mention here, nurses usually forget to check the if they are giving any blood pressure medicines, they forget to check the blood pressure of the patient. So if you are giving any blood pressure medicines, any hypertensive medicines, or any calcium channel blockers or any beta blockers, make sure that you check the patient heart rate and the blood pressure. Okay, same applies to the diuretics. If you are giving Lasix to anybody or any other sort of diuretic, bumetanide, you make sure that you check the blood pressure of the patient, because if they're having low blood pressure and then you're still giving them diuretic, it will make it more lower. Okay, so if the doctor is still happy for you to give the diuretic despite the patient's blood pressure is low, you give it, but you have the documentation that you have confirmed it with the doctor. All right, and also if you are giving insulin to the patient, you need to make sure that the blood sugar of the patient is checked and what is the blood sugar levels. Okay, so if the blood sugar levels are good, within normal range, you are very happy to proceed. Yeah, so if the blood sugars are low, for example, are you going to give the insulin? If it's a long acting insulin and patient's going to eat, then you can give the insulin, but I would say hold it for 30 minutes to 1 hour, recheck the blood sugar, give him something to eat or drink, or the glucoboost if it's very low. Okay, so you can also give the glucoboost, and when you recheck the blood sugar after 30 minutes and see how much is the blood sugar, then you can give the long-acting insulin or short-acting insulin. Usually the patients have long-acting insulins, and sometimes if the blood sugars are unstable or they are out of the control, then they may have short acting insulins as well, or rapid acting insulins as well. I don't know, I can't speak for some reason today because all of a sudden it started raining, so I'm just thinking, watching and speaking. Yeah, so you need to check the blood sugar level of the patient. Same applies to the digoxin tablet. If you give digoxin or any other sort of beta blockers, you need to check the heart rate of the patient. Or you are giving a calcium channel blocker, so make sure you check the heart rate of the patient. Do not rely on the pulse oximeter. So I would say the pulse oximeter here, they give you accurate heart rate and the pulse, but I always recommend you checking the pulse manually for 1 complete minute before you give digoxin, before you give any other blood pressure tablet or calcium channel blockers. All right, because of the rhythm, because of the heart rate, sometimes on the pulse ox it can give you a totally different rating. All right, so yeah, that was the basic checks. And I also want to highlight that if you are in a team, you're in the ward, and you can see that, oh, your colleague just finished the drug round and I haven't finished that, I haven't finished my drug round yet. No problem, no problem at all. Take your time, do not make mistake. All right, so maybe her patients didn't have loads of medicines, and yours, you have loads of medicine, maybe 10 tablets per patient or 12 tablets per patient. So it depends, every patient is different and every team is different, and everybody works differently. So you need to organize yourself and do the drug round with a peaceful mind, because we don't want you to make mistake. We don't want you to make a mistake and give wrong medication and cause trouble or cause emergency. Maybe the blood pressure was 70/50 or 70/40, and you've given Ramipril on top of that, or you've given Losartan or something like that. So just be very careful, no rush. All right, you have if you are doing early shift, you have 6 hours. If you are doing long day, you have 12 hours to do your things. All right, so it is very, very important that you you take your time and do your drug round at peace. All right, and the other things I want to also mention, I mentioned already about the wristbands, I also mentioned about the allergies. And also, if you are a nurse, check the status of the patient, whether they are nil by mouth, whether they are lactose intolerance, or if they have any other sort of problems that you need to be aware of if they are going for any procedure. Okay, so if they are lactose intolerance, here I notice one thing: even if the patients are lactose intolerant, they are still taking dairy products. For example, they want milk in their cereals. So just be careful and ask the patient, okay, so you are lactose intolerant, but you are happy to take milk in your cereal. Yeah, okay, so you've given the milk, and patient may say that, oh, I've been doing it forever, in all my life. All right, that's all right. So you give it and then document it. Okay, that patient is lactose intolerance, she still want the dairy products. All right, and patient is alert and oriented. Okay, they are not they have the mental capacity to make that decision. All right, so we are talking about the medicines. I can also pay some attention to the stat medications. So as we all know, nurses, we need to be very mindful of giving stat dose and also the PRN medications. Here, most of the times what happens is patient has regular paracetamol 4 times a day. Then they have codeine 3 times a day. All right, you've given paracetamol and codeine. The patient calls you and say, oh, nurse, I'm having pain. Can you give me some pain relief? You check in the PRN medications, you see cocodamol, and then you get excited. Okay, I'm going to give you cocodamol. So you didn't check the time that you gave paracetamol and codeine to the patient, because maybe you didn't know that cocodamol contains codeine and paracetamol. Okay, so you are giving the same medication again. So that's a drug error. I don't want you to make that mistake. Please check if your patient is on paracetamol or codeine and they have cocodamol as PRN, because I see a lot of people, a lot of nurses make this mistake, and then at the end of the day they'll be writing reflection. We have to do a DATEX. DATEX is a learning event, so if we report something through DATEX, it's a learning for the other nurses. Okay, so yeah, so if you give paracetamol or if you give cocodamol on top of paracetamol and codeine, this is a double dose and it's a mistake. Okay, so what you are going to do is you are going to report it to the doctors, you are going to report it to your supervisor, your band 6s, your manager, and then you are going to complete a DATEX as well. So it's a lot of work, and I don't want you to make drug error, because with the medications error you can even lose your PIN. So I just want to say it also with the controlled medicines. It's really, really important that you pay close attention and you follow the policy and you follow the rules and regulation in doing the controlled drugs. What are the controlled drugs? Morphine, fentanyl, buprenorphine patches, any sort of controlled medication that you need to do. You need 2 people to do the medication. You need to bring the book with you according to your organization policies, okay? So you need to bring the book, the CD book, to the patient, okay? When the patient takes it, you check, you sign it with it that you have witnessed it. Some people, what they do is, to save time, they don't witness the nurse giving that patient their medication, because for all the controlled medication, 2 nurses need to sign the medicines. One person, one nurse who is giving the medication, the second nurse who is observing, okay, who is confirming that yes, I observe, I witness that this nurse has given this patient this medication. Okay, so in terms of CDs, I would highly recommend you not to trust anyone. Okay, if you have done a medication, CD medication, control medicine with somebody, and then you didn't see that nurse giving that medicine to the patient, you cannot witness sign. You cannot sign it saying that yes, I've seen it, the nurse has given the medication to the patient. What if the nurse didn't give that medication to the patient? What if the patient is not present in the ward? Okay, since you have already signed it, saying witnesses, I am the witness nurse, you have already signed it in the CD book, that is a big drug error. And then your PIN can be cancelled, your PIN can be revoked, your nursing license can be revoked as well. So pay close attention to the control medicines. Do not trust anybody. If you are a nurse, you are giving the CD cupboard keys to somebody, remember who you gave it to, and then make sure they bring back the key to the nurse in charge, because that's a big responsibility and we don't want any troubles. Yeah, so that's all about medications. If you find this video helpful, please give it a thumbs up and let me know in the comment section if you want to know anything else, and I'll be happy in making any sort of videos for you, educational videos for nurses. Thank you so much for watching. Take care. Bye bye.